Community health centers contribute to the community in the sense that they really provide preventative and, in some cases, life-saving measures to people who just can't get health care anywhere else.
The difference between a community health center and an independent practice or a group practice, as a provider you have an opportunity to work with individuals that really appreciate your care.
I think by having the clinic there and having the sliding scale in particular, it allows people to not only obtain the health care that's important to them and their families, but also to do it with a sense of dignity. Because if they can only pay $10, they can pay $10.
Grants Pass really has a small town feel to it. I see my patients in the grocery store and at the art night. You really feel a bond with the community.
I chose Southern Oregon because it really is an outdoor mecca. Good schools, small enough community that it's not a big city, but big enough to where you have most of the things that you need.
My favorite event in Grants Pass is the Growers Market. It's wonderful. We walk down there every weekend, meet the farmers, meet the people producing.
Oregon's a very special place to live. It's got some of the most beautiful natural wilderness. It's an hour drive to the ocean. It's an hour drive to skiing and snow sports. We're surrounded by wilderness. We have one of the best national parks around with the Oregon Caves Monument. There's hiking, fishing, rafting, swimming. There's a very large community of organic gardeners and farmers who have farmers markets all through the summer.
At Siskiyou Community Health Center, I've been able to grow in my practice. I've started a family, expanded my career, and I've been able to balance that.
The ability for me to practice medicine the way I wanted to, and I really did enjoy the readiness of, administration presenting themselves to take care of all the things that I needed and explaining everything to me and letting me know that they'd work with me. It's a nice and very well managed clinic. I don't think I can compare it to most FQHCs out there. I think it stands above that in terms of how the setting is. It almost looks like a private practice setting. Siskiyou
Community Health Center has individuals on staff that do all the billing, do all the credentialing, do everything that an independent physician would have to do on their own or hire people to do for them.
The team effort, the fact that all the employees that handle everything, the billing department's here in-house and I can go to them anytime I want. IT's in-house. I really want to focus on my patients and I don't want to have to worry about the stressors of finding ways for them to get care. I just want to give them the care, and at a community health center they can get that.
The nice thing about our size practice is there are colleagues right down the hall. We support each other. We have other resources that we can draw from to assist patients with medical issues, financial issues, socioeconomic issues, life challenges.
We have procedure rooms available. At this point we have a lot of things in place to do extra and outside of just office patients. We can do the procedures.
The community of Grants Pass has people from a wide variety of socioeconomic backgrounds, and our clinic practice reflects that. I came to Siskiyou 15 years ago as a health service corps scholar with a 3-year commitment, and I'm still here. So a year ago, I became the chief medical officer at Siskiyou Community Health Center. I've been able to continue delivering babies, which I love, without having to worry about the impact of malpractice coverage on my practice. And I've been able to do this in a clinic where I feel that I'm supported, I have the support of my colleagues.
Administration offices always have an open door policy between the CEO, CFO, and COO. That's huge.
One of the greatest rewards is to be able to follow families through time. And we have clients here that we've taken care of for 3 generations.
And few patients, 1 or 2 patients a day say you a thank you. That is a sincere thank you, you know. They're saying, we are glad you're here. That makes a big difference.